Hi guys, this is Dr. Fatima Qureshi. Today I have a case to discuss with you, and this is commonly seen in our patients. If you come closer, I will show it to you. See that? Look up please. The redness in the eye. Look to the left and look to the right. You got that? This is a red eye. Now, in my videos, I have talked about red eyes and why red eyes can happen. Sometimes there is a corneal abrasion, sometimes there's a scratch, which is an abrasion, sometimes it's a deeper ulcer in the eye. It could be infections, it could be related to contact lenses, it could be inflammation. It could also be related to side effects from certain drops, such as glaucoma drops can cause red eyes also, such as latanoprost, which is used at nighttime, okay? So these were just the basic causes of red eye. Trauma can also cause red eyes, but in her condition, the reason I wanted to make this video is because there's so many patients who get terrified when they see that condition, as you already know, right? Your friends will say something, your family may say something. So this is known as subconjunctival hemorrhage. What that means is there's the conjunctiva, which is the white part of the eye anatomically. I already showed it to you on the model. And then the area beneath it, which is subcon, sub means below, right? That has capillaries that burst sometimes. And that leads to this condition, which is known as subconjunctival hemorrhage, which looks very bad, but in reality is going to get better slowly and gradually. The redness is going to fade off, okay? Now, the main thing is that the patient had, do you want to tell them a little bit about what happened, the incident?
It was one of the evenings when we were having a freeze in Lafayette.
Louisiana.
Lafayette, Louisiana, and we had ice and water on our cement, and I went outside to walk the dog, and I slipped. On the ice.
Because we're not used to the freezing temperatures
and I had
in the
tennis
south.
shoes on.
Yes.
The tennis shoes went flying and I went down.
She hurt her arm and had to go to the ER for that. And it's important to mention that because the ER can fix this part, okay? They can stabilize the patients. But when it comes to eyes, as I've said in my other videos, they're not equipped with this instrument, if you can show them. The slit lamp, they don't have that training, they don't have the equipments, they don't have the machines required for that. So they told her to come here, and that was excellent. That's another thing I want to tell my patients. For eye conditions, I've said it, traumatic eye, red eye abrasion, eye ulcer, decrease in vision, gone vision, don't go to the ER, come to us. Come to an eye doctor, eye specialist, come to a medical facility which deals with eye problems so that we can help her. Otherwise, if you had gone to the ER, they would have given you a bill for $1,000 or even more, and then would have referred you here, right? So they did the right thing to stabilize her arm, okay? They did put her on augmentin, but for the eyes, they didn't know what to do. So they did the right thing by sending the patient here. So shout out to Lafayette General, and who else? Oshner, Women and Children's Hospital. Good job, guys. Right. So because we want to help you, right? We don't want you to go from hospital to hospital, clinic to clinic, and get lost in the system. We don't want that. Now for her, I'm going to treat her still because she has some tenderness, right? And I told her I'm going to put her on a steroid drop just because I found a little inflammation. I found some SPK, superficial punctate keratitis. This area does look a little bit swollen, and it is known as conjunctival chemosis. So I'm going to put her on a mild steroid. I'm going to do spread forte and then just taper it, okay? So that her condition is not causing discomfort, which she is complaining about. Her vision is fine. I did not see any traumatic cataract or any traumatic glaucoma because when she fell, luckily she didn't fall on this side, she fell on this side, and she fell on her arm, okay? So we're not going to think too much along the lines of trauma or something happening in the retina. However, I did tell her I'm going to see her back within like 2 to 3 weeks, right? In order to examine her thoroughly for her retina, dilate her, check everything again, okay? So that's what we're going to do. And I also told her take a warm washcloth and put it on her eyes and don't press it. Just be very gentle so that it will be soothing for you.
Okay.
Yeah, and we have a lovely patient. Tell us where you're from originally.
New Orleans, Louisiana, and I was in the theater.
She was an actress. I love that part. I know, right?
And also a bit of an entrepreneur.
Awesome.
And my husband had famous restaurants in New Orleans.
Oh my God. And for people who are not from New Orleans, because we have international audience also, national and international, New Orleans is famous for music, food, art, culture, you name it.
Yes.
Yeah, they have a big history. Food is big in New Orleans, okay, and it's tasty. I've
Yes.
tasted New Orleans food; is amazing.
It was Greco's restaurant, and we also had the Greco's Fish Market restaurant,
Oh wow,
and also Broussard's restaurant, which
That's
was
awesome.
a fine dining.
that's so cool. And then tell us a little bit about this necklace. Come closer, see her necklace. It's beautiful.
My husband was king of Zeus, which is a Mardi Gras crew in Metairie, Louisiana, which is,
Big festival thing
yes,
that
it's a
happens.
big festival.
Yeah,
And it's always the Monday before Mardi Gras Day.
which is coming up.
Yes.
Yeah.
And my husband was king, and he gave this to me the night before he rode in the parade.
Isn't that amazing? Such a sweet story, I know. And this is pure gold with all the diamonds, and it looks gorgeous. So we had a conversation about her necklace also. It's so amazing. We love our patients here. This is the culture of the South, I guess, right? Deep South,
Yes.
you would call it. Louisiana is known for the hospitality, and again, they're known for the food and diabetes. And we won't talk about that part.
But they're also known for their wonderful doctors.
Oh, that's so nice. That is, we love our patients. You know why now.
Yes.
Awesome. Thank you so much, and
Thank
you have a
you.
blessed day.
You too.
Thank you.
Thank you very much.